Welcome to Startup Health TV. I'm Logan Plaster. It's hard to think about ERs without thinking about crowded waiting rooms and long wait times. That's just one of the pain points that CEO Alex Guastella was trying to address with his startup, Quick'rCare. He and his team created a platform that allowed patients to find and locate local ERs and urgent care clinics, pre-register online, and then save their place in line in order to shorten waits. Then the pandemic hit. ERs emptied out, many urgent care clinics had to shut their doors, and Alex had to adapt. One way he and his team innovated was to move upstream from registering patients really into the telemedicine space, using AI to pre-triage and direct patient care. They also discovered that their platform was really well suited to addressing the challenges of vaccine rollouts. So they spun up a vaccine-specific platform based off of what they built, and they're already starting to partner with states. It's all in the interview. Stick around.
Crazy.
Quick'rCare, thanks for joining me today for Startup Health TV.
Thanks for having me.
So the last time that we talked, I want to say it was April of last year. It was really the height of the first wave of the pandemic. And you were really thinking through kind of how Quick'rCare was going to respond to that. I understand that before that, your core product was to really help people find the ER or urgent care clinic they needed in their moment of crisis, and then sort of save their place in line, help them get to where they needed to go. So take me back to when the pandemic hit and kind of frame up kind of what the product was before, and then we can kind of talk about a little bit of the evolution of how you have grown in the last year.
Yeah, sure. So, before the pandemic, our main objective was to use smart technology to help people, or sick patients rather, access the right level of care in either the ER or urgent care. And we did that fairly well. I mean, we had over 200 facilities using us up until that point. And then the pandemic hit, so we had to migrate, because a lot of our partners that had like urgent care specifically had to shut down those facilities for a time period, rethink their model. So we had to just kind of pivot, or it's really not a full pivot, but slightly pivot to kind of a little bit more robust system, obviously, and then just build better relationships with our current customers. And I feel like we did that fairly well.
We've had this issue with a lot of these interviews where we'll use the word pivot and everyone will say, well, it wasn't really a pivot. This whole year has been a year of evolution, of responding. We have to sort of figure out what the right terminology is, because it's really a refocusing sometimes. You mentioned the urgent care clinics some of them having to shut down permanently or for a period of time. You've really got a lot of urgent care partners and got your finger on the pulse of that market. How did you kind of flesh out, how did the pandemic hit urgent care clinics, and kind of where do you see us right now coming out of that?
Yeah, so we saw a sharp decline even on our platform without the clinics opening, of kind of patients just not making or holding their spot in line at an urgent care, which our average urgent care can see upwards of 200 patients a month from us. So we definitely saw that, and a lot of it just had to do with confidence, or I don't want to say telehealth, because I know telehealth was a band-aid in the beginning, and telehealth is definitely a great feature and functionality, but it can't solve everything. It can't fix a broken bone, obviously. So we had to adjust a little bit for that. A lot of our ER partners, a lot of our urgent cares as well, are owned by bigger health systems. So since the decline of emergency visits had happened, obviously, that doesn't mean people weren't getting sick. They just were trying to tough it out, and we're going to see the backlash of that as of very recent, especially with things like minor heart attacks that have most likely had happened, but they never went and got treated. So there's definitely a lot of things that we had to adjust to in the moment. Fortunately, we didn't see at least the temporary closures and restricted hours or restrictions on who can go to the ER. We didn't see that for more than 2 months, 3 months, really. I mean, obviously there were still restrictions, and everybody just wanted to be more careful. And I know it's state by state, but, we were able to kind of, repivot our offering to something, at least the offering is viewed slightly differently, which then to the general public made it, a much more advantageous product to use. So.
Break that down for me, how the product has shifted, really kind of walk me through the user experience of it.
Yeah. So think about not waiting at all, right? I mean, so that's, I think if I said that to every, CEO or ER director in the country, they would be like, you're crazy, right? And it totally is true. I mean, I think there's always going to be some level of patience we have to have. The ER is always going to be unpredictable. It has to be, right? I mean, we can't plan the emergencies. Same thing with urgent care. However, there's a huge population of people who end up in these facilities that do a lot of research prior to going to that facility. And if they can do more pre-registration, more of that paperwork before they come in,
yeah.
they end up in the facility, they get treated much faster, and they get out much faster. And so you can kind of have a safer, healthier waiting room by not having as many people around.
Where do we stand sort of looking at the landscape of emergency medicine? Where do we stand in terms of really turning the tide on getting people registered ahead of time, keeping them out of the waiting rooms longer? I know it's like you're working on a piece of that, but there's a whole sort of universe of healthcare that is slow to move in that direction. So kind of, could you comment on the landscape as a whole?
I would say that I know we've had a lot of conversations with strategic officers at health systems in conjunction with their staff that runs the ED. And there now is the new push, right? Because I think we saw a lot of that push towards telehealth in the early days of COVID. And there was a huge spike, and then there was not enough providers, or they couldn't diagnose everything. I mean, it was literally like, sounds great, but maybe we're trusting it too much. I mean, and that's not saying that telehealth can't do a lot more. It totally can. But so now our conversations are shifting towards, we know people are going to get sick. We know we need to be there for them. We also need to be, and I totally agree with this, safe, not just for the patient, but also for the staff. Because if staff starts going down, patients can't get treated. So we have to kind of think of it in all factors. And I mean, in quite easy retrospect, I have children, and I think about just when I go to the pediatrician's office with my son or my daughter. I know there's a well visit side, and then there's a sick side, right? But just having a side of the room sometimes, I don't want to say isn't enough, because I know that real estate isn't cheap, but the fact that we all enter through the same place, we all touch the same pens. That's how we spread any type of virus, any very easily. So if we can make the entrances and the waiting rooms much safer, just for everybody in all aspects, then we could slow down any type of spread, even if it's just the flu, right? We could slow down many different viruses.
How do you see the future of sort of patient navigational platforms like Quick'rCare in a more hybrid model, in a more hybrid world, where you're trying to decide in the moment between telemedicine visit versus in person, and it's all a big sort of technological mix?
Yeah. So just like what we've invested our dollars on, using. Without getting too deep into the buzzword world, using artificial intelligence, somewhat more decision making than just a Q&A, right? That's where we've gone, and it's worked out really well, because we've been able to identify patients that aren't just needing to go to an immediate care type of facility, but they can go to telehealth. We could get them to an MSK visit. Things a little bit more specialized, and even sending nurses or like with one of our partners, sending an EMT to the house, right? So there's a lot of different variations. We've definitely been saying, let's look at the risk factors we built based on what we know we need, and we already have the customers aligned to want to be part of that strategy. So it made sense for us to deploy as long as it made sense.
So you've moved upstream. You were letting people sort of register and find their place, and now you're moving towards
Right.
helping them make clinical decisions about, well, helping them make their own patient decisions about their care, and adding in some of that intelligence. Is that what I'm hearing?
Yep. Yep. Absolutely. Yep. I mean,
Eh,
just gotta take more factors into consideration, right? So it's not just, what are your symptoms? It's, how long have you been searching those symptoms? Are you really just, kind of doing a lot of research around a specific problem? As long as we can collect more of that data, and use it in the right way, not use it in a negative way, which is, how the only way we like to build technology. Then yeah, I mean, listen, that we're just trying to help get you to the place.
What's the state of that market, of that pre-triage, that AI-driven uh, patient triage? I feel like I hear bits and pieces of it here and there. This idea of trying to pull some of that data together before the visit and maybe even direct somebody. Do you feel
Right.
like, yeah, where do you feel like we are in the maturity of that idea?
I think maturity is the right word, but in a different way. I think we need to be mature about the business decision on that, because not diagnosing a patient isn't cool, right? I mean, at the end of the day, in technology, we try to say, oh, we could solve that, we could diagnose, we could do this, and I do think that we can in some variations, right? But if we step back and we say we're using this for routing, right, and decision making, not actually diagnostics, it's just not as, I think for a lot of people it doesn't become as exciting, because I think if you can do the take it the full 9 yards or full 10 yards, I mean, it's that just seems a lot better of a function. But there's too many times where it's the wrong answer, too many times where that patients are being told the wrong things, or there's too many times that you go through that and the default is call your doctor. And so it just kind of, you always end up in those roadblocks. Not saying we can't get there one day, but that could just be a little further down the road than right now, and that's okay.
Yeah.
We have to build on what we have now.
Yeah. There's too many decision trees that end with go to your local ER.
Or it's the, laundry list of every disease that your percentage of what you've told us is this, and it always leads with like the worst. And you're
Yeah.
like, everybody's get then you've got, either you create temporary hypochondriacs,
Yeah.
hysteria, and that's not
Yeah.
healthy for
Yeah,
people.
just to cover your own risks, and you end up with something that's not useful.
Yep.
No, that's really what I was getting at with the maturity of this, because people are trying these elements of it that aren't really addressing the patient's needs, and
Right.
but the attention is there to try to really crack this nut. Part of your strategy has been to have some big health system partners, some really great institutional partners. I think Jefferson is one of
Yep.
them. Is that right?
Yep.
And that's kind of where the rubber meets the road in terms of what they can and want to implement, and what their patients, how they respond to it. So over the last 10, 12 months of refocusing Quick'rCare, how have your partners responded? Kind of where are they at in this sort of telemedicine response to COVID, and kind of how that works with Quick'rCare?
Sure. So I mean, almost every single one of our partners already had some version of telehealth, and it got bombarded, of course, especially in the early days. And then I think it was then sought after as the tool of choice. And then the decline started. I mean, I think you always knew that there was going to be a rapid decline at one point, because offices started to reopen. Elective procedures were going to happen again. So that happened, right? Our partners, our biggest take was, how can we help, and not be noise, right? We didn't want to be noise, because we knew, until the disease experts were able to figure out containment, which I think maybe even if the virus itself wasn't contained, but the strategy was, we knew what we were doing at that point to at least get to that point. Then the hospital started getting confident. Within 2 months of the pandemic, every one of our partners already felt more confident. Again, there were still restrictions, but they were ready to go, right? And so we have to, obviously, congratulate them, because they're they're humans and they don't deal with this every day, and they're prepared for this. And that response was pretty quick, at least from our health professionals. So, we just want to be aligned with them. And again, they did turn to telehealth a lot in the beginning. We do see that we need to get people in these offices again, because I can't fix that ankle, right? I mean, you got to come in, I'm sorry. But, and they're there now. And that's why 21 is a refocus on their, internal strategies of how to make sure they can treat their populations.
At the height of the pandemic, we really weren't sure, though, if urgent care clinics would come roaring back, or if we were going to see
right.
a big shakeout, like how much of that urgent care traffic could be handled by telemedicine. Was it going to cut in half or what? Sure. So what are you seeing? Are you seeing it come roaring back? Or are all of those urgent care clinics going to come back to life this spring?
I wouldn't want to be the one to make that prediction, but I would say urgent care would be the harder of the hit in general sense. If they, obviously we see a lot of them start to practice. They start to practice telehealth for urgent care, right? However, we've also seen a shift in their operations as well, where they've become micro testing centers, and some are even trying to do some vaccinations, which, again, I think it's noble, but they're, and it's great that we're chatting now. I can tell you a little about what we're doing with that. But, so I think that urgent care will come back. I just don't know if it's gonna probably have to expand its services, or it won't be able to survive in the new market. I mean, you're gonna have to have more going on there.
Tell me what you were alluding to a second ago with the vaccinations.
Yeah. So, if you look at the current deployment, there's, every state's got their own phases and approaches to how they're deploying vaccines. I think I prefaced it by always saying, I think we're all doing the best we can, knowing that, when we do, for us, it's reservations. For, my prior company or any of the other software access plays, they do online appointments. Vaccines is really a hybrid model of a reservation or hold your spot in line, and a queuing system rather, and an appointment. And it's because the appointment visit is extremely short. And on top of it, there's an unknown number that we don't know is how many vaccines you're going to have. I mean, there's a fine, we know short prediction, right? We know out to so many dates, right? But we don't know what we're going to have maybe in 2 months, because it's up to the manufacturers to do that.
Yeah.
And that's okay. I mean, I think that's logistics, and that's, a whole other science. So we brought on a few state customers as of the last 3 weeks or 4 weeks now, ripping out what their current model is and using ours, because we were able to kind of redesign our a white label version of our software, and without much effort. I mean, a little bit of effort, but not much effort. And so, like in New Hampshire, it'll start on the 17th. You'll be able to use our platform to not just register for a vaccine and find and go to all the different locations, but we were able to decipher between first dose and second dose, pre-qualify the patient based on their medical risks, the current phase, and on top of it, help them as a state manage how many vaccines are where, and how do we make sure they're being allotted to in the right manner. So
interesting.
States, and it's, I felt like we were late. We weren't late. We were the ones screaming to the top of our lungs back in like November, right when they were going through like last stages of approvals, because we knew it's not even about phase 1 and 2. I mean, that's definitely difficult. But when you make it more generally available, but it's still going to be, it needs to be heavily monitored. It's a nightmare of an experience. And so I think that's why we're seeing some of the problems.
I've heard story after story of a lack of database, proper database management and record keeping. So it makes perfect sense that your queuing software could be adapted, reskinned, and redeveloped to help people sign up for vaccines, but then on the state side, help them keep track of who's gotten which one.
Yep.
I know,
even give the digital ID. I mean, I know I think it's been over processed about this whole like passport idea. I've seen too many companies pick up all of a sudden, oh, we're doing that. And then, there's a lot of social risks to that as well. And then why have a direct app for that when if it's digital and it's obviously on a phone, why not just use it in the wallet? It could be secure very easily. So we made that part of the offering. We did that in like 36 hours. So it wasn't like that was a difficult project, but so I just think there's a lot of really easy pieces of technology that we were able to, use. We were already 90% complete for vaccine management, and we just needed to like add a few things. So we put our hat in the mix, and I think when a lot of the states started seeing what we have, they were like, "That's exactly what we've been talking about." We've gotten that way too many times in our conversation. So it's been pretty surreal. Nice. And then obviously it's made us extremely busy. Not just busy, not like we weren't busy before, but it's, when you're deploying an entire state, dealing, working with military personnel to do training.
It's a new product launch.
Yep, of course. So it's like, but now we're doing it. We're getting, cobwebs off with that. We're redefining, we're becoming this entirely reshaped company. It's pretty exciting.
So you say reshaped company, Quick'rCare, will that remain as the foundation, or are you okay?
We're still Quick'rCare. We sold them Quick'rCare. It's not like we've created a new product in terms of a new name or anything. It's because just the way we deploy is different now. And we did have to build a little bit of some more management functions, but outside of that, it's been fun. It's been exciting. Obviously, there's a lot of pressure because you've got direct deadlines, but we're cool with that. We usually make those deadlines. So
that's awesome. And your name is flexible enough that it really kind of applies to this new situation. Who doesn't want to have Quick'rCare?
That's right, man.
I think everybody would. Well,
I mean, from all these issues we hear with the vaccines and people waiting, and then our biggest reason why we threw our hat in the mix was, we just heard too many stories where people would show up, and then there's no vaccine waiting for you. And that's just, listen, I think there's always going to be some level of error, especially when you're trying to do something extremely fast like this. But we're talking, tens of thousands a day, every day. That's just, we couldn't let that sit.
Yeah. And stories of people not remembering whether they got their, which of the vaccines they got the first time because it was given to them on a little piece of paper and it was never put into a database anywhere. So
doing our best, man.
folks like you need to come with their, with their best offerings to fix that problem. So Alex, that's the time we have. Really excited to hear about what you've built, but also how you are refocusing around the current challenge. And obviously, I'm going to need to check in again soon to see how all this is going in 2021. So thanks for your time.
Sounds good. Thank you.
All right. Take care. Be well.
All right. Bye now.